For ambulance crews across England, this is one of the busiest times of the year. But with greater demand being put on accident and emergency departments, the British Red Cross says its volunteers are helping transport patients home in many areas. And it's warning there's what it calls a humanitarian crisis in public hospitals.
We see in our work every day our volunteers supporting people to come out home from hospital or helping prevent admission to hospitals. Increasingly chaotic situations where someone might be discharged from hospital without the right preparation, even cases where someone discharged without clothing.
New National Health Service figures show last week 42 A&E departments ordered ambulances to divert to other hospitals, double the number during the same period in 2015. And last month, 50 of the 152 NHS hospital trusts in England had to declare an alert because they couldn't cope with the number of people seeking medical attention. NHS bosses reject talk of a humanitarian crisis and say most hospitals do have adequate plans for this winter.
The NHS is not in crisis. We have a very comprehensive escalation plan which uses the whole of the local economy, for the local authority, for the hospitals, for the ambulance service, for GPs, to step up when the hospitals get into difficulty. And the diversion that you talk about is part of that escalation plan.
But in many cases, patients are still being kept in hospital when they should be discharged. The social care they need isn't available because of government spending cuts. Once again, NHS trusts across the country are urging people to stay away from A&E departments like this unless it's a real emergency or a life-threatening illness. But experts say that until they can get people out of hospital on time, they're fighting a losing battle. The opposition Labour Party is demanding the government outlines plans to, quote, fix the failure in the NHS, with many doctors and nurses talking of chronic underfunding. Nadim, Jazeera, London.